All right, to continue where we left off with the last video, I'd like to address the job of the juxtaglomerular apparatus. Just a couple of things. We were able to see where the juxtaglomerular apparatus was here, shown in, and I want you to take a second to appreciate the location of this. It's in the proximal convoluted tubule, just after the loop of Henle. So I've got all of my reabsorption, except for the fine tuning that I'll have in the collecting duct and the rest of the distal convoluted tubule. All of the reabsorption's done. So the juxtaglomerular apparatus is in a key position to essentially assess the effectiveness and the efficiency of the reabsorption that has taken place thus far, and then directly relay that information back to the glomerulus and the Bowman's capsule to adjust filtration as necessary depending on the readout from the juxtaglomerular apparatus. So how does it work? Well, let's take a second to draw what we were just looking at in maybe a zoomed up style fashion. So if this was the glomerulus, let's put the afferent arterial on this side, so blood flow is coming in through this direction. That makes this the efferent, which is the exit. And up here we have the glomerulus itself. Of course, this is where filtration takes place. We've got Bowman's capsule surrounding it. And as blood comes in, depending on the pressure, and of course, with the fine-tuning of some of the other mechanisms that we talked about with the podocytes and the mesangial cells, we can affect the overall rate of filtration. And then what's left over, obviously not all of it leaves, what's left over is going to come and leave through the efferent arterial. Just beneath that, as we showed just a minute ago, we see this section of the proximal convoluted tubule. This is the distal convoluted tubule, and this will be running in and out of the screen. And it's these cells here that we want to make particular mention of. These are called the macula densa cells. And their job is to detect salt concentrations. Now, this is really interesting because remember what we just said, that they're in the perfect position to assess the efficiency and effectiveness of the kidney in reabsorbing salt and water, along with other things. But this is really focused on salt and water. And they're right at the end of the loop of Henle, which is all focused on the active recovery of both water and salt. Now, I want you to think for just a second, what if we had a scenario where we had high salt? Well, what would this mean? The macula densa cells, as they see high salt, they're going to interpolate that. These are not stretch receptors. These are receptors for salt. But they're going to interpolate that as most likely high blood pressure. How might you say, could I use salt as a readout for blood pressure? Well, I want you to think about it for just a second. Remember, if we were to draw just a quick view of how this is working, right? Here's the loop of Henle, proximal convoluted tubule. I'm sorry, the nephron, we've got the proximal convoluted tubule, the loop of Henle, and then we come over here to the distal convoluted tubule and the collecting duct. And these macula densa cells, they're sitting right here. How would high blood pressure affect this? Well, if we follow the blood, right, the blood's going to come in, it's going to leave through the efferent arterial, and then we have this structure, the vasa recta. Doesn't quite look like this, but anyway, this is the idea. It travels along the loop of Henle and creates a really nice area for all of that water and all the salt, everything that we're absorbing, to come back into the blood. But if we take one of these and take it in cross section, right? If we have increased hydrostatic blood pressure in here, that means the force pushing out is a lot higher than it should be. So if we have high blood pressure in the vasa recta, then things like water and salt that we're trying to recover in the loop of Henle are trying to come back in, but they're having a hard time fighting against that high blood pressure, and so they don't make it. And what that leads to in particular is increased salt returning through the loop of Henle. So as we register high salt, we're going to interpolate that as high blood pressure. Now the converse is also true. If high salt equals high blood pressure, and this is probably where the macula densa cells really come in handy, then low salt is synonymous with low blood pressure. And this is the system that I'd like to explore for just a second. If I'm detecting low salt, and the cells that are going to do this, again, these are the macula densa cells that are detecting salt. If they detect low salt in the distal convoluted tubule, this suggests low blood pressure. Now, they're seeing this from two different eyes. They're seeing it locally in terms of the pressure going into the glomerulus. And if I have a low pressure in the glomerulus, then I have a low filtration rate and I'm not being very efficient. And also globally, what's the blood pressure inside the body? Both of those will be taken into account. So what happens? When we see low salt, the macula densa cells release through paracrine signaling a soluble factor that is going to come bind to these cells wrapped around the efferent and afferent arterioles. Just like in other places, the structure of the arteries and arterioles, I've got smooth muscle here. And that's what these cells are. These cells are called juxtaglomerular cells. And essentially, this is modified smooth muscle. And if I've got low pressure, then what do I want to do? I want to increase the pressure in the glomerulus. So this paracrine signaling, what is it going to cause? It's going to cause smooth muscle relaxation. Here on the afferent side, because if I relax the afferent side, this is going to expand the radius, which is going to allow more volume to come in, and this is going to increase the pressure. That's how it takes care of it locally. But also, we know the second thing that the juxtaglomerular cells do is they will release renin. We've seen renin. Renin, of course, is the trigger in the angiotensin-aldosterone system. And we talked briefly previously about how angiotensin is going to cause global vasoconstriction and also work to increase water reabsorption, both with the effect of increasing blood pressure globally. So that describes one of the key ways that the afferent and efferent arterioles are regulated in terms of their diameter, and we know that that's important because of the effect that it has on the overall pressure of the system. We discussed how the macula densa cells detect salt, sodium chloride, and how they use that information from the salt to interpolate the pressure in the system, and how that small portion of the distal convoluted tubule is so important to making sure filtration runs smoothly.